pregnancy is a very, complex and a very extensive topic, but I will try my best to, just break it down. First, we will go through all the different trimesters of pregnancy, what are the tests that we need to do. Kiwi પાંચ ચીજો છે જે સૌથી important છે, the top 5 things that we should be caring about to have a healthy pregnancy and of course to have a healthy baby ultimately. પહેલા તો જ્યારે બી વુમેના પ્રેગ્નન્ટ થાય છે તો આપણે શુક્ર કરીએ છીએ, પંજતન પાકનો આપણે વસીલો લઈએ છીએ કે આપણી પ્રેગ્નન્સી હેલ્ધી થાય. And of course, at the end of it, we do want to have a healthy baby, right? So, first of all, of course, what is pregnancy defined as? જ્યારે fertilization થાય છે between sperm and an egg, this leads to the formation of an embryo. This embryo then forms a hormone called beta HCG, and usually this is the pregnancy hormone that is detected, in the urine or in the blood, and that's how we detect the pregnancy. So usually, within the first few weeks, as soon as conception happens, this gets released from the embryo, and that's how we know that pregnancy is taking place. Now, how a woman finds out is that once she misses a period, we understand that this could be a pregnancy, and then we check for this beta HCG level in the urine and the blood. So, the first trimester, which is from conception up to week 12, is the first trimester, right? The first 3 months of pregnancy. So as you can see, the baby is really small, and usually this part of the pregnancy is within the pelvis. So it's not yet coming into the belly, which is into the abdominal area. So, pregnancy, uterine growth takes place within the pelvic area. Usually after the 13th, 14th week, which is the second trimester, this continues up to the 28 weeks, you can see that now the uterus the baby no development is taking place and the uterus is growing, and now this pregnancy becomes more of an abdominal pregnancy. So this is the time where we can feel the uterus growing over the pelvic bone. तो अपने हाथ से feel करी सके छे baby na body parts. We can also listen to the heartbeat with the fetal monitor. And, we can measure the fundal height. Usually when you go for your checkups, they try to do that so that we can see how the pregnancy is developing. And then, of course, we have the third trimester. Usually this is after the 28 weeks. Usually 29 to 40 weeks. Between 7 to 9 months till the end of pregnancy, which is week 40. And of course, as you can see, mostly this pregnancy is becoming an abdominal organ. It does push through the lungs and, the chest area sometimes, of the mother. And usually, the baby grows bigger in this part of the trimester. Okay, so I'm going to divide this now. So we are going to talk about the first trimester. So usually the first trimester it is the first 3 months of the pregnancy up to 12 weeks. Kind of the hormonal changes, thai chain and that. Now, the reason I chose to divide this is because the symptoms that a mother may experience are quite different. And the treatment that we may do for these symptoms is also very different, right? So first trimester ma initial hormonal changes hoy che, usually the early signs of pregnancy or early symptoms of pregnancy. So of course, first the lady will miss her period, and at the same time she might experience some nausea, some vomiting, just feeling a lot of tiredness, fatigue. They'll feel a lot of weakness and tiredness at this time. Some people will experience urinary changes, a lot of frequency in urination because, the pregnancy is, the uterus is pressing onto the bladder. So in our JC, bladder irritate thai you get increased urination. Some people will experience some headaches or dizziness. Usually the dizziness is because of blood pressure changes. Ghana logon blood pressure thodu low thai jai che pregnancy ma. There are some physiological reasons for that. And because of that, some people will experience a lot of dizziness and headaches. Of course, they can also have some gastric symptoms, such as heartburn, gastritis. They may not feel very well, especially after food, they may get heartburn. And then, of course, weight changes, but mostly the weight changes takes place in the second and third trimester. Okay, so now we defined the second trimester as between 13 to 28 weeks. So this is sort of the middle part of the pregnancy. આની ખાસિયત એમ છે કે જે nausea and vomiting જે first trimester માં feel થાય છે, it actually improves in about, more than 50% of the people. And they start feeling really good. They start feeling a lot more energy. The tiredness and sleepiness is gone. They feel great. They start to sort of say, okay, my energy is back, and they're able to exercise and walk and do their household things. And, mostly the symptoms are more towards, sometimes, of course, the urinary symptoms may continue, and some people may develop a little bit of back pain because now the pelvis is expanding. Remember, apne je diagram में જોયેલું, the second trimester, the baby is becoming bigger. So it is becoming more from a pelvic pregnancy to an abdominal pregnancy. Yani je baby che, it's coming into the abdomen, which is, abdominal cavity na andar che. So some people will feel pressure because of that. And a lot of times
mute on.
People will experience urinary symptoms and maybe sometimes even some constipation because of that, because of the pressure in the colon area. And of course, it depends upon the health of the mother beforehand, because if she has any carpal tunnel syndrome or any other medical conditions beforehand, because of that, she may have tingling or numbness in her hands. Some people will develop carpal tunnel syndrome during pregnancy because of the hormonal changes, and that's how they may experience some of those changes as well. Okay, so now let's go to the third trimester. So this is after 28 weeks up to delivery, right? And again, same thing. Now the baby is much bigger. It is occupying most of the abdominal cavity. So it is putting pressure on the rest of the organs. And because of that, obviously, thodu vadhare pressure thai sake che on the bladder, તો વધારે urination થઈ શકે છે. Especially at night time, she might even have difficulty sleeping, finding a perfect spot to sleep. So usually apne recommend kariye che ke, they can put a pillow under, in between their legs, or, a pillow behind their back, because, they will also get a lot of back pain. And as I said, sometimes it can also push against the lungs, and some people will get a lot of shortness of breath, especially on exertion. So as you can see, some of the common symptoms, as I said, are, shortness of breath, back pain. Sometimes they can get swelling in their legs. And then, of course, if they've had heartburn before, sometimes it can get worse in the second and third trimester. Okay, so, as I said, pregnancy is a huge topic. But we will try to go one by one as to the top 5 things that you need to do, the top 5 tips to have a healthy pregnancy and have a healthy baby. And while we're doing that, I'll also go through some of the tests that we do, some of the tests that are done by the family doctor initially. And then for the second part of the pregnancy, when you're being followed up by the obstetrician, what do they do, to follow along with you and make sure that the pregnancy is healthy. Okay, so top one thing is regular care. Now, this prenatal care actually starts even before you conceive. So this is what I tell my patients. Okay, listen, you know what? As soon as they get married, I say, okay, when are you planning to have a pregnancy? When are you planning to conceive? Because if you are within 3 to 6 months, that's when we should be starting to do your checkups, which is a physical. We want to be measuring your blood pressure, your weight, do a blood test, make sure that, you don't have any deficiencies. Specifically, agar iron and a B12 deficiency hoye che, we want to cover it up before you actually get pregnant. Then we want to check your vitamin D levels. Again, vitamin D is very important for pregnancy as well, and for fertility. So we want to make sure that these levels, or if they have any of these deficiencies, they're already being taken care of. Now, if you already have a history of any deficiencies or thyroid problems, this is a good time to, check everything and make sure that all the levels have been adjusted and that you're taking the right medications. And then of course we want to take a family history as well. We want to make sure कि अगर आपनी family में diabetes छे or high blood pressure छे, or if your mother has had any complications during her pregnancies, we want to know about that, right? Just so that कि अपने खबर होए, how to pregnancy in the future. And then a very important point is about immunizations and vaccinations. घना लोगों जो immigrate अपने करीने आविए छे इंडिया पाकिस्तान से या Middle East से, sometimes we have not received all the vaccinations. So I take this time to actually look for any antibodies for MMR, measles, mumps, and rubella. Make sure that I update their tetanus shot if they've not had it, in the 5-10 years. अगर ना लेवो होय तो પછી अपने આપી શકે છે. Especially even things like hepatitis B is very important to make sure that we have done it before. And then of course, agar flu season hoy che, to I make sure that people get the flu shot. And the reason for that is because some of these vaccinations we cannot give during the pregnancy because they are live vaccines. The tetanus shot and flu shot are extremely safe and they can be given. However, JK MMR and usually hepatitis B vaccinations apne pregnancy mein nahi aapta. So we have to actually wait till you deliver the baby to give these vaccinations. Okay, so first trimester, let's say now that a lady has missed her period, and we have done a positive test, either a urine test or a blood test to make sure that she's pregnant. So then, what is the first thing? Usually, the first visit is taken care of by the family doctor, right? So family doctor knows you; they know your risks, and they know your family history. So they will make sure that they will go to it accordingly and make sure they'll do the necessary tests. And I mentioned that if you do have, iron deficiency or a thyroid problem, it's a good time to follow up on these things and make sure that, those medications are given to you and those doses are adjusted. And then, of course, we want to check your weight, your blood pressure. As I said, sometimes gana logon blood pressure down thai jai che, right? It goes a little bit low. So we want to make sure we monitor that. And then usually je first test hoy che, blood work hoy che. We also do tests to assess for the immunity. Remember, मैं आपने कीधेलु for rubella and hepatitis B. So in Ontario, we do check for four different things. That includes hepatitis B, rubella, HIV, and VDRL. And these four tests are important. You have to have negative screens to be able to, for us to refer you to the OB and for you to be able to have a delivery in the hospital. So these screens are important that are usually done in the first trimester. Of course, in Apache, usually first visit we will do an ultrasound. Ultrasound in the first trimester is usually called a dating ultrasound, which we want to usually check the heartbeat of the baby. So we want to make sure that it's a viable pregnancy and that there's a heartbeat and the pregnancy is within the uterine lining at the right position. So that's usually the first visit, right? Now, second visit, as we are going along, your family doctor will tell you to come back and follow up, do the tests. And the other second test that is very important, which is also done, in the first trimester, it's called the EFTS or the prenatal screen. It's a combination of a blood test and an ultrasound. Now, this ultrasound usually measures a particular measurement called nuchal translucency, which is measured for any spinal defects. And there's a blood test done to look for any chromosomal abnormalities or any genetic disorders, specifically being Down syndrome. So, agar apna family ma koi che who has had any chromosomal abnormalities or Down syndrome, if there's any genetic concerns, it's important to let the family doctor know. So, this test can be done, or sometimes there's another screening test that can be done as well, depending on what risks are identified. So, as I said, EFTS is offered to everybody in Ontario, and usually that tells us whether there is a chance of having a baby with any chromosomal abnormality. Now, this test is extremely time sensitive. It has to be done between 11 and 13 weeks. So just remember, make sure that you are aware and you don't miss any of these tests. And then, as I said, this is the second, this is usually the first ultrasound, second or first ultrasound, depending on which one you do. So first one is the dating, second one is the EFTS, which is the screening ultrasound for genetic abnormalities. And the third ultrasound that's usually done between 18 to 20 weeks is usually for the anatomy scan. So ये आज ये ultrasound che it looks for all the baby's organs such as the heart, make sure there are four chambers in it, the kidneys, the abdominal organs. It just kind of does a quick screen for that, and this is the time when you can find out the baby's gender as well. And of course, it looks at the baby's growth, the growth size, and the baby's heart rate. So these are sort of the prenatal testing that is done. So it is very important that you attend all the regular prenatal appointments, because different appointments have different things that we go over and we give advice about, and different tests are done at different times of the pregnancy. So it's important that you follow up with the family doctor. And then at this point, when all the tests are done, a referral is made to the obstetrician. Usually, apne Ontario ma shared care kariye che. So half of the pregnancy is taken care of by family doctor, and then usually after 20 to 24 weeks, you get referred to the obstetrician, and then they sort of take over care, and then usually you get delivered by the obstetrician. Okay, so number two, what is important? Now, our chisma ghana myths che, because everybody thinks that if you're pregnant, you can eat anything and everything, and that it's okay to just indulge and go crazy. But it's not true. Of course, now more and more people are well educated about it, and they understand that it's a very important thing to eat a balanced diet. Your diet should be including all the three main uh, you know um, building blocks of the body, which is carbs, proteins, and fat. And everything has to be in a balance. And of course, we also want to eat a diet which is rich in iron and calcium, because those are important minerals for the body, for the baby's growth. However, what I usually tell patients is what you need to do is have a high protein, low carb diet, specifically if you have a history of gestational diabetes. Um, Now, just looking at how much protein we need, so if you look at the specific guidelines, we should be taking at least, a pregnant woman should be taking at least 1 gram of protein per body, per kg body weight. Okay, so that's 1 gram per kilo body weight. So for example, agar a lady is weighing about 60 kilos, right? So she needs about 60 grams of protein minimum in a day. Of course, if you're an athlete or you're really muscular, then the protein requirements increase. But in general, that's the math. And then of course, carbs is important too for the energy. And fats is also very important, but good fats, right? Because those are important in making the hormones and some vitamins in the body. Now I'm going to spend some time on calcium intake. Now calcium is ingredient, and specifically dairy, which includes milk, yogurt, cheese, all of these things. Because calcium is important not only for the baby's bones, but also for the mother's bones, right? So I usually explain to patients that, listen, the baby is like a parasite, right? It's growing within your body. It's going to take everything it needs from the blood of the mother, right? तो ये इन्हें जब भी calcium की ज़रूरत है, say it's going to take it from the blood, and the mother's body is going to take it out from the mother's bones to supply the baby. So ultimately, the mother may suffer from weak bones, and that's why we get a lot of joint pain and back pain postpartum, which is after the baby is delivered, because you're not having enough calcium in the diet during the pregnancy. So if you are lactose intolerant, or if you don't like milk, or if there's any problem, then just take a calcium supplement, right? But otherwise, you at least need 2 to 3 servings of dairy every day. And then, of course, as I mentioned, you also need iron. So, lots of greens, especially spinach and kale. And then, of course, protein. You all know all the good supplies of protein, such as eggs, meat, milk. Of course, milk and cheese also have good amount of protein, but you want to make sure that you're eating good amounts. Okay, so we talked about diet. So now we know that we can't eat anything and everything, and that we should be mindful of what we are eating, specifically because we don't want your weight to just skyrocket, right? We want to make sure that you have a controlled weight gain. I know ghana time pehla, the philosophy was, okay, just eat everything and you can gain a lot of weight. But We want to make sure that the weight gain is controlled. Specifically in the first trimester, usually I tell patients I don't want any weight gain. Some people end up losing weight because they're not feeling well, their appetite is not as good, they're vomiting. But usually in the second and third trimester, we make sure that you gain only about 5 to 10% of your body weight, usually not more than that. Okay. All right. Exercise. Of course, now that you guys have heard that exercise is important for everything, right? But घना लोगों ने वहम होई छे about exercise. I get this question a lot, especially in the first trimester. Everybody's saying that people think that they need to go for bed rest, especially if there's any bleeding or spotting in the first trimester. Everybody's sort of scared about it, and they're scared about having a miscarriage or losing the baby. So unless and until you are high risk, or your doctor specifically tells you to go for bed rest, you should be exercising in moderation, which can include, just some light exercise, walking, stretching. Of course, I'm not telling you that go run a marathon or go climb a cliff. No, we are not saying that. But whatever you've been used to doing, you should be actually doing that, which is walking. And, even if you're doing swimming and yoga regularly, we do encourage doing that, during the first and second trimesters as much as you can. Of course, if you have a lot of fatigue and tiredness, yeah, be mindful of your body. Go take a rest, go rest for 15-20 minutes, and then go back and go on with your exercise. In fact, now there's a lot of prenatal yoga classes, that a lot of gyms are doing. And in fact, I heard that even you can do it online. There's some virtual yoga programs available. In fact, YouTube पे बड़ी आप Google कर सो या YouTube पर जो सो, there's lots of virtual yoga sessions available. But it's just being mindful that they're catering to pregnancy and to prenatal, for the prenatal time. In fact, I actually one of my patients told me about this. There's an app which actually you can. It's, of course, it's a paid app, and you can register yourself with it. You tell them how many weeks you are and when is your due date, and depending on your sort of gestational period, the number of weeks of pregnancy that you are in, they give you the specific diet that you need, what kind of exercises you need to do. They send you like emails and handouts, and they also have live yoga sessions which you can log into, which I thought was really cool. So specifically, of course, when you're doing prenatal yoga and doing stretches, you want to exercise specifically for your back, because back pain is extremely common. And also you want to do some stretches to help stretch the pelvis, because remember, now from the first trimester to the second trimester, the baby is growing and becoming an abdominal organ. So the pelvis needs to stretch to allow the pregnancy to grow. So it is very important to do some pelvic stretches, because as the pregnancy grows, it even puts pressure on the back. तो घणो जरूरी है कि अपने back ने भी थोड़ा stretch करिए. Make sure the muscles loosen up. And of course, there's a lot of prenatal massages that you can go for. And specifically, I want to tell all those people who have benefits, who have insurance plans, please remember to take a letter from your doctor, because they will specifically say on it physiotherapy and massage therapy for prenatal, and you can actually use this not only during the pregnancy but also postpartum. So if you have coverage, please, you should use it. It's very important to take care of these things also. Okay, so I did mention a little bit about healthy weight, because we know that if you have a controlled weight gain in the first and second trimester, it can, reduce a lot of complications. Specifically, if you have a history of gestational diabetes in the first pregnancy, or a family history of diabetes or high blood pressure. So, just be mindful of what you're eating and how much weight you're gaining. And as I mentioned, we want to gain only about 5 to 10% of your body weight. Most of the weight gain usually actually happens in the third trimester, because that's when the baby is growing. So, but remember, the weight is only, 2 to 3 kilos. So the rest of the weight, whatever you're gaining, is actually on you. And the problem is losing this weight after the delivery, postpartum, right? So that's why it's important to be mindful of how much weight you're gaining, and just, follow your doctor's instructions on that. All right. So number 5, okay. avoiding harmful substances. Of course, you know, अपने तो सदा होनी छे अपने तो मुहर्रमात से दूर ज रहिए छे तो सवाल ज નથી હોતું, you know, about tobacco and alcohol and smoking. But I actually wanted to mention a couple of things here regarding some of the medications and drugs sometimes that get prescribed to us or that we just end up taking. So, for example, apne agar a regular cough and cold, right? So you don't have to take, medications. You know, sometimes they're off the shelf, but you don't need prescription medications most of the time. You know, you can just do gharnu ilaj. You can take vitamin C, or you know, haldi doodh pi sako cho. There's a lot of homeopathic medications actually that are available for cough and cold. And they're very safe in pregnancy. For example, Stodil che, Helixia che, they're very good for cough. Of course, if you have an infection, if there's a throat infection or a urine infection, and your doctor prescribes antibiotics to you, then definitely that's a different story, and you need to take it. But agar, you know, regular day to day things hoy che, if you have a little bit of back pain or you know things like that, you don't necessarily need to take a painkiller for a headache or for any kind of pain. So we want to avoid, you know, any prescription drugs specifically, you know, because of course we know that, you know, these levels can transfer through the placenta into the baby, and then it can affect the baby's liver as well. Okay, and another point I want to bring out here, it's harmful substances is not just those things that we ingest in our body. That's also what we inhale. So we should be a little bit mindful about the environment that we are in, you know. Of course, you know, stay away from extremely dusty or smoky environments, and especially if people have allergies, you know, be mindful of those things. And of course, जिम के मौला फरमावे छे कि अपनी जे ज़हनी हालत छे, जे अपनी mental health छे, it's extremely important as well, because we know that, you know, if you are stressed, if you're feeling you know, if you're feeling depressed, or if you have any other symptoms that are causing anxiety, you know, that can obviously affect your mental health and then ultimately affect the health of the baby and the growth of the baby, right? So always healthy mind, healthy body, and healthy baby, right? So we have to be a little bit mindful of those things. Okay, so we talked about all the top five things that I, you know, wanted to mention, which are extremely important for, you know, a healthy pregnancy and, of course, a healthy baby. I did not go a lot into, you know, labor and delivery. Every person is different, and you know, every person experiences you know, different things. But at that point, this is usually very important for the first two trimesters. By the third trimester, you know, you are followed along by the obstetrician, and depending on your risk factors and your particular health, they usually will guide you accordingly. જેમ કે ઓન્ટારિયોમાં આપણા જે સગલા hospitals છે, when you go register yourself in the hospital, they usually will give you a handout with all the information, you know, with your birthing plan and what kind of things that you would like to choose, what kind of the things would you want to choose for your pain control, how would you like to deliver, who would you like to be present around you. So these are the things that, you know, you can choose. And, you know, it's nice that they are mindful and they allow us to make some decisions before, you know, we are actually going into labor. And then, of course, if you've had a C-section before, you know, those are the things to also keep in mind, that am I going to go for a natural delivery, or, you know, I've had a previous history of a C-section, that am I allowed to have a natural delivery, or do I need a C-section again? So everybody's factors and, you know, risk factors are different. So we have to consider them on an individual basis. Okay, so to summarize, as I said, it's very important that we have, you know, prenatal checkups, not just during the pregnancy, but we want to start at least 3 months prior to the pregnancy. And the reason for that is because if we want to, you know, monitor your any deficiencies, we want to pick them up. Usually at this point, we will also ask you to start taking prenatal vitamins, specifically folic acid. I didn't mention that, but usually if you are getting pregnant after 30, 35, after 35, we specifically recommend taking folic acid additionally, because it helps to prevent any spinal defects. So that is why it's very important to get your checkups done much before you think of conceiving. And then, of course, once you conceive, you want to make sure that you have regular prenatal visits with your family doctor, and then, of course, with your obstetrician. Then we talked about some foods, specifically about protein. Remember, we said 1 gram of protein per kg of body weight, the mother's body weight. Okay, so if you have a 50 kg mother, you need at least about 50 grams of protein every day. Okay, but we have to make sure that our weight is healthy as well, because we want to avoid any complications during labor and delivery. So be mindful of what you're eating. Remember, high protein, low carb diet. And then, of course, we want to exercise as much as possible, do stretches for the back specifically, for the pelvic area as well. And of course, we want to make sure that we have a healthy labor and delivery. So that for that we can do a lot of prenatal yoga, a lot of prenatal exercises, a lot of physiotherapists who are certified. They specifically will train you how to what positions to specifically go for back pain, and then how to stretch yourself, and they make you practice certain positions as well when you're going through labor. All right, and then of course, lastly, we talked about things to avoid. We want to avoid any cough and cold preparation, especially some of the stuff that over the counter japne laiye che, like Advil cold and sinus, Nyquil. All of these medications have decongestants in them. Usually, we want to avoid those. Some of those cough syrups also have certain ingredients in them that actually can affect the blood pressure of the mother. So we want to avoid those. But there are a lot of alternatives available, specifically homeopathic medications that you can take for cough and colds. And of course, for fever, you can take Tylenol. But then always, if you're in doubt, you want to consult with the family doctor. Of course, and if there's an infection, we need to make sure that we get you treated immediately with an antibiotic. The pharmacists I want to mention are very big, wealth of knowledge. So if you are not sure about something, should I take this in pregnancy or should I not, you don't really necessarily need to see, the doctor. You can just ask the pharmacist, and they usually have the ingredients them, and they can check for you whether it is safe in pregnancy or not. Most of the medications over the counter are labeled, and they will say safe in pregnancy or not, or whether to consult a doctor or not. Now, most of them will say consult a doctor, but as I said, you can definitely consult the pharmacist because they can give you very good advice. Okay, so thank you so much for paying attention. And if there are any questions, you can ask me now, or of course, you can always message us, and we're happy to answer any of your questions later on also.
Thank you so much, Sakina Ben. That was very, very, very informative. Yeah, just there's so much to think about during pregnancy and before pregnancy, and that was a really, really great summary. I have a couple of questions in the chat. So someone's asking if you can talk a little bit about home delivery. She's heard that women in her community talk about it, and they do home deliveries as well. So can you talk a little bit about that as well?
So usually there are two ways of getting delivery done in Ontario specifically. So one of them is through the obstetrician, and the second one is through midwives. Now, usually, if you choose midwives, they will try to accept you a little bit before the obstetricians do. So, as soon as you get pregnant, you can actually call them, and they will do your initial blood work, and sort of they can do all the testing that we do. And I think that they do give you the option of doing a home delivery. Specifically, I've heard, if you look at Mississauga, Oakville, Milton, we're GTA, we have lots of hospitals close by. But I've heard in a lot of the communities, specifically where, hospital care is a little bit, difficult. For a person who is absolutely healthy and has no complications, they do choose certain patients carefully and give them options of home delivery. So in the perfect setup with the perfect patient, it is possible. But this is a discussion you need to have with your healthcare provider to make sure that you're eligible for that.
Thank you. And
The
someone also just wanted to clarify, you had mentioned 3 months before, so starting the prenatal vitamins, even healthy eating, exercise. They just wanted to
Yeah.
clarify, is that 3 months before trying to conceive? That's what you're talking about?
So, if you look at the recommendations, they say 3 months before conception is when you should be starting to take the folic acid, right, for its full effect. But of course, yeah, there's no guarantee that you're going to get pregnant. So it's a time frame, but usually most people will take about 3 to 6 months or even sometimes up to a year to get pregnant. So if you're above 35 and you're, high risk, the recommendation is that you can continue taking folic acid with prenatal vitamins. We usually don't stop, even though it has been 3 months. We usually tell people to continue taking. In fact, they take it before conception, during pregnancy, and then even postpartum. I didn't mention that, but I make sure that when we do the first postpartum visit, I remind patients that you have to take your prenatal vitamins because sagla bhuli jai che. They're just like, baby's out, I'm fine, and they forget about it. But in fact, if they're breastfeeding, the lactation period is extremely important, and also, you need to eat good food. It's you have high calorie food, and it's very important to continue taking the prenatal vitamins till you're breastfeeding.
Yeah. So typically we say 6 weeks after
Yeah,
delivery you can take it, but you can take it for longer as well if you want. And the prenatal vitamin for younger women is a good multivitamin as well that you can just take all the time as well. So that's
exactly.
an
Yeah.
option too. Um, you had mentioned the prenatal and the folic acid. So prenatal vitamins do contain folic acid. Would that just be enough just to take the prenatal on its own, or would you also need to take folic acid on top of that?
So for younger women, just the prenatal vitamin is enough. But for women above 35, there is a risk of having spinal defects. And if, of course, as I said, मैं smoke तो नहीं करता, but for women who are smokers or who have had a history of any babies with genetic or chromosomal abnormalities, the recommendation is to start a higher dose of folic acid.
Mhm.
So there are some combinations available now. For example, Pregvit folic comes with 5 milligrams of folic acid within the prenatal vitamin, and it usually requires a prescription from the doctor. So you can opt for that, or you can take them separately. It's the same thing.
Yeah. Okay. And then a question about the genetics testing you mentioned. You said at 11 weeks. There is the option to go private for private genetics testing as well. Can
Mm-hmm.
you speak a little bit about that too?
Yeah. So if the so in Ontario, if the initial prenatal testing is abnormal or if there's something shows up, there is another test that's done. It's called the Panorama test, which is sort of a more detailed genetic test. It is actually a blood test, and Ontario will cover it under OHIP if your initial testing is abnormal. But let's say you're worried and you want to go for the test yourself. It is actually about, I think, about $400-500, and you could need a requisition from your doctor. So there are two forms that need to be filled out by the family doctor, and then usually it requires a requisition. The patient, they usually, the doctor signs it and gives it to the patient, and you can go to any life labs and get that testing done. And it gives you a detailed report about the risk of having any genetic or chromosomal abnormalities. It gives you the sex of the baby, and it's pretty accurate. It's 99.9% accurate in terms of some of the testing that it does. If you just go to Panorama, if you Google it, you will get all the detailed information on the website about what is the right time to do it, and what all it tests for. And I think there's another, you can get detailed information. I think there's like a basic one and a enhanced one. But
Okay.
all the information is available on their website.
Yeah. And then say for example that test was abnormal as well, what would be the next step? So say there is a high risk of a genetic abnormality, what
Mm.
would happen next?
So usually at that point, we refer the patient to like a high risk clinic. In fact, just last month we had a patient like that, and the high risk clinics are pretty good. As soon as we send the referral, within 2 days, the patient got an appointment, and they will go through all the options. One of the options is further testing, because again, remember, this is just a blood test. The other option is to actually take out, the amniotic fluid, which can also have the genes, the genetic material of the baby, and that can be more accurate. Or the second one is to take a piece of the placenta, which is again from the baby's side, and that can also, be done. That's called the chorionic sampling or CVS sampling. But the problem with both these two tests are that there is a risk of miscarriage. There's a 1% chance. So, of course, the physicians usually will, inform you about all the risks and the benefits of the test. And then, of course, it's the patient's decision whether to do these testing or just to continue the pregnancy.
Yeah. Thank you. Thank you so much. If anyone else has any questions, feel free to write it in the chat, or you can unmute yourself and ask. Just in the interest of time, it is almost Maghrib. So I just wanted to let you know that the next talk will be on July 28th. So just keep an eye out for emails about that. And that will be on the postpartum period. So just a follow up from what Sakina Ben has talked about today. So yeah, if anyone has any questions, we can stick around for a couple more minutes. Otherwise, feel free to email us on the email address that we have sent before. And yeah, we look forward to seeing you at the next talk. Sakina Ben, thank you again so much for the talk today.
Absolutely,
We
my
really
pleasure.
appreciate
Thank
it.
you
It
for
was
giving
great.
me this opportunity.
Of course.
I'll just wait for a minute or two, just in case somebody wants to ask something or discuss something. This is also your opportunity to share your views. If anybody has any anecdotes or, ideas to share, we're happy to hear them.
Or even your experiences. You can talk about those if you wanted as well.
Actually, these are very personal and intimate experiences. So I think everybody, it's hard to share them, and also, but it's good to talk about it because sometimes other people can learn from them. So don't be shy. If you've had a bad experience, maybe you can share it, and it can be a better experience for someone else. I think Aji Maghrib 9:03, so we are good. We do have some time.
So there's another question. What are the best times to conceive? Which phase? So what time in your cycle is the best time to conceive? Sorry, Sakina Ben, you're on mute.
Myself.
There
Okay.
you go.
Best times to conceive. So this is technically, I think you're asking me about the fertile period. So that means that, so you have to know your cycle. Day number one is always the day you get your period, right? So that's day number one. So let's say if you have a cycle of 7 days, 7 days you will bleed. The 14th day is ovulation. That's when the egg is released from the ovary. So the fertile week is usually day 12 to day 17. Okay. So 2 days before ovulation and 2 to 3 days after ovulation is the best time to conceive. So you want to do a little bit of timed intercourse during this week. Every other day is preferable, and this is the best time, when the egg is sort of available for conception.
If you just wait till ovulation day, you may miss your window because once the egg is
Yeah.
released, the chances of fertilization are low, very low. So you want to try a little bit before the ovulation, a little bit after, and that's the best window. Don't just wait for the day of ovulation.
And
Yeah.
the thing is, because the sperms can live in the tract for about 2 to 3 days. So that is why we recommend a couple of days before ovulation.
Okay. All right. Well, if there's no other questions, then we'll sign off. Sakina Ben, thank you
Yes.
again, and we'll see you all at the next talk.
Inshallah. My pleasure. All right.
Khuda Hafiz.
Khuda Hafiz.
Khuda Hafiz.